The World Health Organization warns there's no evidence that people who have recovered from the coronavirus are protected from a second infection. South Korea's CDC says that 268 patients have retested positive after it was thought they had recovered. So now that's raising some very troubling questions about whether this virus can be reactivated. Senior medical correspondent, that's Dr. Tara Narula, shows us why the answer could be critically important.
It just felt like at times somebody was like stabbing me with an ice pick.
Colorado nurse practitioner Lisa Merck has been documenting her coronavirus journey since she first tested positive in March.
There's a stigma, I feel.
As a healthcare worker, Merck gets repeat tests.
Do you want to tip your head up?
So she knows when she can safely return to work. On day 21 of isolation, she got good news.
Your test was negative.
But just 7 days later, she got a retest and was shocked at the results.
This is really scary to me.
Merck was once again positive for COVID-19.
It's really confusing. It's very frustrating.
Do you feel like you got infected twice with coronavirus, or do you feel like that test that came back negative was a false negative?
I feel like the test that came back was a false negative. I mean, there's no way to tell.
Viral PCR tests based on nose and throat swabs like these are reliable about 60 to 90% of the time, depending on the test.
Can people get COVID twice?
So I don't think we know the answer to that yet.
Dr. Stanley Perlman, a professor at the University of Iowa, has been studying coronaviruses like SARS and MERS for nearly 40 years.
50% of people or so who had a SARS infection actually still have antibodies now, which is 17 years later. And so that would tell you maybe most of them are protected against SARS again. For MERS, the amount of antibodies seems to decline fairly rapidly if you have mild disease. If you have severe disease, it lasts much longer.
Just like with MERS, Dr. Perlman believes more severe COVID-19 symptoms may mean longer-lasting immunity.
So this disease, we think that you will be protected at least for some amount of time, especially if you had pneumonia. If you have only the upper airway infection, you may get infected again.
Perlman says the good news is that COVID-19 is not mutating quickly.
So this means that making a vaccine is more feasible because the virus isn't changing.
What do you make of the Korean CDC saying that coronavirus may in fact be reactivating in people who they initially thought were cured?
Yeah, the question is whether there really is reactivation or it's low-level infection that was not detected for a period of time and now is detected.
Martin Hirsch of Massachusetts General Hospital agrees. He says genetics and several other factors affect immune response.
Younger people, healthy people without any underlying conditions are the most likely to develop prolonged antibodies.
With COVID-19, the World Health Organization says we need more evidence about how effective the antibodies are and how long immunity will last.
When we're talking about this idea of potentially getting infected for a second time, what time frame would sound reasonable to you for that to make sense?
I think those people who test positive, then negative, and then positive within a few days or a few weeks are almost certainly not reinfected. I think if you go beyond that, a few months, a few years, then you can start talking about reinfection.
What is your biggest fear?
Lisa's right, Tara. Tara joins us now. Lisa's right when she says it is. How can it be that you can have the antibodies and not be immune to the coronavirus?
It's definitely confusing, and a lot of people equate the two terms. But antibody is not synonymous with immunity. Antibody just tells you that you've been infected before. Immunity is really this more complex idea. It's a continuum, and it depends on several things. It depends on the number of antibodies you produce, the type of antibodies you produce. So there are neutralizing antibodies. Those are the ones we know that really work most effectively at neutralizing the virus. You want more of those. It also depends on other parts of the immune system. We have T cells that work with the cells that make the antibodies that help, and then we have memory cells as well that produce antibody down the road when you see the virus again.
We are all still learning so much. Thank you, Tara, very much.